We are here to reflect on how Kenya can better align its financing needs with those most at risk of being left behind, especially vulnerable and marginalized populations across all ages and backgrounds. Let me begin by acknowledging our co-organizers, the Government of Kenya, through KIPRA and KBNS, and our partners, the World Bank and UN Women. Your commitment to evidence-based and inclusive development is deeply appreciated. As Nelson Mandela said, there can be no keener revelation of a society's soul than the way in which it treats its children. This reminds us that inclusive development is not just a technical goal, it's a moral imperative. We must build a Kenya where every child, regardless of background, has the chance to thrive. Devolution was meant to bring services closer to the people and ensure that no county was left behind. And I must say that counties have stepped up. Yesterday, we saw in the nutrition side event how stunting chronic malnutrition has reduced in Kenya from 26% in 2014 to 18% in 2022. This is a remarkable achievement.
Counties are very critical in providing key social services like health, early education, water, sanitation, and social protection. Counties on average are spending about 42% in the financial year 24-25 of resources in social sectors, having increased this from about 39% in financial year 2019-2020, as he has already mentioned. However, the number of children facing multiple deprivations is not reducing as fast. In fact, with analysis showing it is increasing towards 55% by 2025, this year. The question is, what could be the missing link between increased social spending by counties and the non-reduction of overall deprivations facing children, what we call child multidimensional poverty? And second question, what action could be undertaken by counties to shift the needle where money spent leads to accelerated poverty reduction? The disconnect between increased social spending and the slow reduction in child poverty is a critical issue that points to inefficiencies in how resources are used rather than the amount itself. It is not the amount that is less, it is how resources are used. The primary missing link is the fragmented, siloed approach to service delivery. Even with increased spending, different county departments often work in isolation, leading to ineffective and uncoordinated interventions.
The Brighter Tomorrows, Breaking Cycles of Poverty for Kenya's Children report draws data from the latest Kenya Demographic and Health Survey, that is of 2022, and applies the UNICEF's multiple overlapping deprivation analysis to provide a comprehensive picture of child vulnerability in Kenya today. The findings show that Kenya is home to 21 million children, of which they form 42% of the population. While notable gains have been made to ensure that child survival education protection is guaranteed, a significant proportion of Kenya's children continue to face poverty, nutrition, inadequate access to basic services, and other risks that threaten their well-being.
There is a common saying by Edward Deming's mathematician and statisticians, in God we trust, everyone must bring data. So at this particular moment, we are going to hear more about numbers. It's going to speak to the report that you have launched. It's going to speak to everything that has been spoken before by the various speakers who stood here.
Looking at the statistics, that children form about 42% of our population. First of all, I want to say that the government has taken a critical step in establishing a department that is now taking care of children. You note that this department was not in place until this year in April. And so that is one step that the government has taken, having looked at the past surveys that have been done on matters affecting children and seen that we need to first establish an office that purely takes care of children. And that is one good step that I can say the government has done. If you don't take care of the nutrition of the mother, by the time the child is born, the child's development will already be affected. Therefore, this program acknowledges that the development cycle of a child starts from when a child is conceived. And we are planning to roll out this program to additional counties. And the next phase will be 20 counties, which have already been mapped based on the poverty index of these counties.
What specific factors could be put in place for philanthropy like KCB Foundation to expand the footprint in supporting service delivery and development in Kenya? And two, given that decline in official development assistance, in your view, what innovative financing mechanisms do you think Kenya can adopt to promote domestic resource mobilization to sustainably fund social sectors like health, education, social protection, and many others that fall within the social sector spectrum?
You are indeed right that aid is in decline. Anyone who's been watching what's been happening with USAID as well as other donors, we know that we're in a world where a lot of the philanthropic capital that has been flowing towards social services is on the decline. And one of the things that has also become very clear to anyone who's in this space is that this is an opportunity not just to try and do the same thing with less, but to really rethink how it is that we deploy and use capital. So to answer your question, some of the ways that KCB Foundation, as well as also indeed the KCB group has been looking at this issue, is around how do we have philanthropic capital being used as catalytic capital. So how do we have this finance that is primarily grants or primarily developmental in nature? How do we use it to spur either private sector or public sector capital in the country? And one of the most exciting things when we talk about social services, when we talk about things like ending multidimensional poverty, one of the most exciting things that can happen is if we look at counties as the engines for which jobs are going to be created in the country. And we all know that one of the biggest gateways towards achieving a lot of our socioeconomic rights is really the ability to have a job.
Climate change and population growth, urbanization, water pollution, and poor management of water resources have aggravated the issue of water crisis, which affects economic activities, food security, and education, as well as health. Now, addressing the first question, what potential exists for the government of Kenya to tap more into PPPs in these social sectors? The untapped potential is immense, especially if we broaden our view of private sector beyond large corporations to include MSMEs. MSMEs constitute over 90% of Kenya's businesses, contribute to 40% of GDP, and generate 80% of new jobs. These enterprises are often innovative startups and community-based firms, bringing agility and local relevance that form PPPs that formal PPPs sometimes lack. rather than focusing solely on big ticket projects under the PPPs Act of 2021, the government of Kenya should embrace a broader partnership perspective, including hybrid and informal models that drive outcomes in health, education, social protection, and WASH. Some examples of these: food for education, which is in the education and health sectors. There are scalable models partnering with county governments, parents, private donors to deliver nutritious meals to over 500,000 children daily across 15 counties in 1,900 schools. This boosts attendance by 10%, enrollment by 20% in some areas, and national exam performance.
For sustainability in terms of financing, social sector, one of the things that we need to have is a coordinated approach to partnering both the having a collaboration between the county government and the national government. We saw how fragmenting approach is leading to fragmenting also our resources. Therefore, for us to target our resources to reach the social needy and the vulnerable communities, we need to have a coordinated approach both at the county level and also at the national level. The next that I would recommend would be to ring-fence the budget allocation and also come up with alternative ways of raising funds. When it comes to mobilization of funds, we do have companies that are having probably negative impact when it comes to issues of nutrition. We could tap into a percentage of the income of this private sector in bringing on board additional funding that can fund the Child Welfare Fund, which is already in place but not operationalized, for us to be able to reach the vulnerable children.
Please join me in thanking Madam P.S. Colleen Ogengo. We also have Madam Mendi Jonjo, Anthony Mwangi in absentia, and Madam Wangoi Karanja, who fit into this panel. What an esteemed panel, distinguished guests. Ladies and gentlemen, let's give them a round of applause.